Good morning, viewers. We do apologize for coming to you a little late in as far as our episode this time around is concerned. This lovely day, the 6th day of April 2023. Good to have you on board. Thank you for choosing the national broadcaster. We are live and coming to you from Broadcast House, Nile Avenue. We are here to celebrate women in all the sectors, and not only in ICT, and we don't do that right here at the National Broadcaster only on Women's Day or the Women's Month, but each day I want to see women on the forefront because it works for us in all angles, not forgetting that there's a boy child and the girl child. My name is Sandra Kahunde. Happy to be here and to be spending this lovely morning with you. Holy Thursday. We just had a message, an Easter message from His Grace the Archbishop, and I'm sure it will work for you as you enjoy this Easter holiday. Make sure you make the right decisions. As we talk ICT and how it has been helpful and benefited or impacted the women in health sector, we need to get some tips on how you're going to enjoy your holiday, and you need to do things right. So we're going to be here getting tips from our doctors for the day. And joining me for this episode, I am so happy. I have brilliant minds, very passionate, and of course they're God-fearing. And this morning, this Thursday, I am joined by Dr. Nwampire Maria Prima. I'll be getting lots of the details you as well. She has a bachelor's degree that is in medicine and surgery. She's a medical doctor at Mulago National Referral Hospital. There's a lot to share. She's a published and publications officer at a patient-centered care movement. She's also an entrepreneur, a co-founder at the Crochetville, Uganda. We shall be getting all that right. And she's passionate about mental health, maternal health, and preventive medicine. That is Prima for you. And I'm also joined by another great and beautiful lady. She's Nyamurungi Tumusime. She's a medical doctor, trained with a bachelor in medicine and a bachelor in surgery. She has done a lot of community engagements and lots of work when it comes to the National Referral Hospitals. She's been in Hoima, in Fort Portal, as well as Jinja. She's enthusiastic about maternal and child health, and like I mentioned, to do with community education as well. There's really a lot to share, and they're also happy to be here and be spending time with you this Thursday morning. Welcome once again to the beautiful ladies. Good morning.
Good morning.
Good to have you.
Thank you so much.
How have you been?
I've been okay.
There's really a lot of work that you're doing for the nation and for the communities where you stay.
Mm-hmm.
One wonders if they want to be like Prima, they want to be like Tumusime. They're like, do I really have to do sciences? What do I need to do to perfect myself? We have people who are always out there trying to figure it out when it comes to making the right decisions. Which courses should I go to? Are the parents also getting stuck? And where should I put my child? Should I engage them into the ICT world? Is it easy for them to get a paycheck at the end of the day, or to easily mingle or incorporate into society when they're done with the university? So we have all those minds going through. We have so many things going through into people's minds, and that is why we are here to share with them. And I am sure at the end of the episode, they'll have the right decisions to make. We hope so. Yeah. Okay. We start at the extreme end. What inspired you to take that path that you're taking? Were you in love with sciences, or maybe your parents made you take that path?
Well, when it comes to inspiration, I think I had 3 pillars ending up where I am today. My first pillar, my first point of inspiration was my father, who is a medical doctor as well. I guess he did it so well that I was inspired. I was really inspired by the fact that, you know, would be there at home in the night, and people come in, they are very stranded, yes. You hear someone screaming, oh, my mother is dying, and well, the next day or the next 2 days, someone is coming in with chicken or matoke. Whenever I tell him this, he tells me, I hope it's not the reason that you're in the field, but there were a few other things. But yes, he was my first pillar of inspiration. And the second bit of my inspiration was that comparing science subjects and art subjects, I think the science subjects went much more easier for me compared to the arts. So it was easier for me to relate the physiology and everything that was being explained compared to the arts and memorizing all those things.
All those
so
things.
yes.
Yeah.
The other thing
and there's
was
too much of theory when it comes to the arts.
yes, it was very relatable information coming to the arts. My third piece of inspiration was my inquisitiveness, especially about the human body. Yes, I always had questions, why is this like this, how does it happen? So with all those coming together and the passion as well, I cannot forget to mention the passion, because you will choose whatever career you want to take, career path, but you notice that along the way, there are a lot of hurdles, and if it's not for the passion, you're going to drop out, you're going to lose it. So the passion is a very important thing at the end of that day. Yes.
Well, amazing. Well, just getting to Musime right here. What made you take that path, your inspiration?
Okay, thank you so much. I am Nyamurungi to Musime. First of all, I think medicine is something that I've always looked into. I've just always felt like it's definitely it for me, like definitely it for me. But I think, you know, one thing that is very interesting is it is very humbling. Like, it is a profession in which there is so much, it is a very noble profession, and it is literally like your God's right hand. Eh? Like, you know how they say that doctors treat, it's God that heals. I think being in the profession, there's so many people actually who I've seen who are like the atheists and whatnot, and they feel like, you know, because you're a science person, you're not interested, like you're not really, you don't understand, like the things of God, you really tend to sideline them because they're explained by science. I think when you're getting into the field and when you see how things operate there, you realize it's a very humbling experience and a very humbling place, and you know that for sure what I am doing, it is just like God. But I think getting into the field of medicine, I think just as she was saying, the sciences seem to make much more sense. The arts were also interesting, but the sciences seem to make much, much more sense. So I think that is basically it for me, and it was honestly what I always wanted, to be honest. And I think I always saw very many women who are in medicine, and I always looked up to them because they were wonderful. Like the people like Dr. Sabrina Chitaka, like Dr. Maggie Chigozi. You look at them and be like, for sure, yes, that is what I am looking at. So yeah.
It's not like way back when you think of a doctor like, you're afraid.
Yeah, it's true. It was interesting. It was very captivating, and being like, yes, I know I can do that too. She's going to come with her injections and things like that. Yeah, very true.
So how is ICT part of your day? Has it impacted your sector, your industry, or the field of work that you do each and every single day?
Very, very much I can say. There is a lot of advancement and improvement that has come up in the health sector that we owe to ICT. For example, I've had a chance of talking to the doctors who trained way back in the 1980s, and then
analog.
Yes, and then comparing to our current generation, and they tell you, oh, so you guys cannot diagnose without a CT scan. Oh, we used to maybe
they never had any shortcut.
They didn't have those diagnostic tools that make life a bit easier for us. So it was either clinical symptoms, then also let me treat and see how it goes. If it goes this direction, it's this disease. If it goes this direction, it's
then
this.
We shall change the prescription.
Yes, our life is a bit easier that you think about something and you have the tools to reach your diagnosis much easier. Yes, that is one of the sectors, but a few more. The other sector is care coordination. I still sit back and wonder how they used to do it, because currently you want to hand over, like it's end of your shift, and you want to tell the next person coming in that, oh, this patient is like this, this and this, and this is where I've reached. You could start from there. And a WhatsApp message is enough
Instead
to
of
do
waiting
it.
for the person physically and explain to them all those details.
Yes, WhatsApp message is enough. So I wonder how was their life there?
It's better to be a doctor now.
Yes, like life is much easier, and we owe that to ICT a lot, with a few other things, as my colleague will be adding on to.
Well, she has traveled, like she has been in so many places, I should say, trying it out. Should I call it ministry? You're too passionate about it all. How easy has it been when it comes to ICT, especially in those other regions where you've been to?
Oh, wow. It's actually this question is actually very interesting, because I have worked mostly in the low resource settings, and by low resource I mean mostly up country, and I'm currently at Chisizi, Church of Uganda, Chisizi Hospital. It's between Kabale and Rukonjiri. But the interesting thing is that it's so interesting how a place that deep, even the roads to there are actually not even well done, but a place that deep has such good exposure that the ICT is good. There is a system that we use in Chisizi called Streamline, and the Streamline system is a module that integrates patient management, the hospital care, the day-to-day running of the facility, and all these things. And when it comes to the resources, you know how sometimes you'd find, like you see on doctors' tables, there are books and whatnot physically. The Streamline system enables you to be able to make research and find out things instantly, like something just on a click of a button, something is already right in front of you. And even the patient care, if a patient comes the other day, and today they've come, they're giving you different information, you say, but I think according to, you know, sometimes like I think patients don't know what information exactly you need from them, but because information is documented in a computer system, it is very easy for you to just look back and be like, I think you've been treated for this before. You were treated with this. How did that go? What happened? Are you still on the
before
treatment?
They mess you up and
yes,
give them another medication,
exactly.
And allergies,
exactly. And that is very easy for you to see when you're not using like papers, and you're like, you give me the other things. Yeah, exactly.
Did you happen to carry it? She's sick and busy. She doesn't have it.
Or even she's not conscious, and the patient is telling you, yes, this information is like, yes, I've been treated, but that was long ago. You're like, okay, it was long ago, but the condition you have is chronic. I want to know how you're doing right now, according to the medication you have and all this. And so I think right now it's in over 40 health facilities, this Streamline system, and my God, it is such a help, because when on your phone you can access it,
even when you're not at the
hospital. Because it is something that you just, it's like a domain that you give in a system. You, of course, you as the medical doctor, you have that access. And even, of course, according to the different levels in the field, everyone has access according to that. Because, of course, the things you need to do as a doctor, a nurse needs to do different things to order for prescriptions and the like. And so because of this system, everything is so much easier.
Is it like you have to go through the orientation, you know, before you, the training, like with when you look at the teachers themselves, the education, the new curriculum, they have to be given that orientation.
Yes.
Is that the same thing?
It's a similar thing, because actually for this particular Streamline thing is that there is, I think there is an organization of people that come and take you through the procedure. But it's something, it's quite easy. And with when you've been working in a place like that, you don't even need like weeks. It's just because it's your day-to-day activities. I need this patient, I need to know their age, I need to know this. So things like that, it becomes very easy to incorporate. But when you've done, it's good for the patient, for you, for your surroundings, those you work with, everything is well documented and organized. So yes,
to ICT.
Yes, definitely, definitely.
Prima seems to be excited about this.
Seriously, clearly lost. We are still in the paper system.
She thinks you're giving it 10%. And 1% for Malago.
Regarding that,
1 to 10.
regarding that,
10 out of 10.
Yeah.
Amazing. I'm hoping that someone concerned is getting this information.
And especially because it's low resource, that is the most mind-blowing thing. It is interesting.
Low resource.
Yeah.
And you are here in the urban sector. You need to wake up.
Yes.
Yeah. Well, Prima, you want to add on?
yes, the other thing that we cannot miss out is the telehealth that we currently have. The fact that there are these
Please say it again. The
telemedicine.
Telemedicine.
Yes.
Where you find that you, at the comfort of your home, you're able to consult a doctor, yes, and maybe have the prescription written, have it delivered. Of course, it has some challenges. I'll give an example of Rocket Health. You've heard about it? Yes, so innovations like those have been aided by ICT, and they've made people's lives a bit easier.
I think also actually even before we leave that, there is these new procedures that are done. The thing that always blows my mind is because these things are actually in a low resource setting for me. Things like laparoscopic surgeries. This is when you're basically using a computerized system to access. And so instead of cutting a patient open, you're able to just put a few holes and then you access and using a computer system, a camera guided system for you to access. And so the healing is much better. The whole process is much better. Of course, it requires a bit more training for the person that's going to operate, the surgeon, yes, but it is definitely worth it. The patients are always much better. The time in hospital, if you're having like an open laparotomy, we call it laparotomy, when they've literally opened you up, you may take like a few weeks to heal and go back home, or more than a few days. You know,
you check someone has a scar from here to down.
Definitely. And you see it takes a lot longer to heal, but when it comes to the laparoscopic surgeries, you find within 3 days patients are going home
and they're able to walk.
Exactly. And the infection prevention is much better. And so these are the things that I'm like always
so
like,
that is in relation to with the new technologies that we have on board.
Yes, definitely.
Amazing.
Yeah, it is beautiful.
You enjoy your work and I can't switch. I can't switch.
It's very beautiful.
You
can come.
You
so it's something flexible. There are lots of varieties, lots to tap.
Yeah.
When it comes to medical itself, what is there to tap?
I think
prescription. The different fields of one to tap.
The different fields in medicine one to go in. Oh, there are quite many. If we look at career-wise, we have pharmacists on board. We have the nurses, midwives, the medical doctors, radiology. Those are the people who help us with the investigations, radiographers and all that. It's quite a lot, though. If I go to medicine as the basic, like the starting point, you can start with medicine at its lowest level, or what we call general practitioners. Then when we go ahead, we go branching. Some people decide to become gynecologists, others decide to become pediatricians, mental health, public health, I cannot forget public and community health for the preventive medicine and community shows like this. Yes, so there is quite a lot. The field is very rich, it is very diverse. At first when you're at senior 6 or high school, you're thinking, oh, I'm going to go to medical school. Yes,
how will I be positioned?
I'm going to go to medical school and that is it. Like, I'll end there, but you finish medical school and you realize there is a lot more to tap in, a lot of things.
But of course with good grades coming with it. It's interesting, and also something else that both of you are passionate when it comes to mental health and maternal health. Please tell us more about that field, because it's quite sensitive, so vulnerable, maternal, and the issues that come through with it. Imagine you've gone through the 9 months and then things go bad at the end of it all, and yet we want more. That's why we always urge government to sympathize and think so much about the women. Tell us about your experiences, or the patients themselves, the challenges that they're through with it. Maternal and mental health.
I think maybe I'll speak more about maternal and child, and she will bring more about mental health.
Because there's a lot of stress with the economy and things like that. So in relation to mental, we need people to really be fit and healthy.
Definitely. I think when it comes to maternal and child health, and maternal and reproductive health, that is an area that I personally am very interested in. I think Dr. Prima is more into mental health, which is true. And I think these fields, when it comes to maternal and child health, it's you know, medicine most of the time is about healing and treating. But I feel like when it comes to maternal health, it's about birthing. Like, you're literally bringing into life
God is entrusting you as well.
Yes, you're bringing another life into the world. And the one thing that we always find so drastic and so very, very, very devastating in medicine is maternal deaths. That is something that even the ministry is involved in. Like, even if you lose a mother,
you lose a mother, and sometimes maybe even the child.
Yes,
it's
but
really
especially
hurting.
the mother, because we have this theme and this mission that no mother should lose her life when she's bringing a child to the world.
We usually say that the rest come in as patients.
Yeah.
This one has come in. We say pregnancy is not a disease, so they are not patients. They are clients.
They are not patients. They are clients.
And the thing about mothers is that, you know, now the thing is, it's very interesting. When you're in the urban settings, you know, we have very many informed patients, and we have mothers who are very educated, and mothers who have done research. They have done Google, but now
they've been telling you what to do.
But the advantage, you see, for me, I feel like the advantage with being around patients that are educated is that it's easier for you to explain to them in in proper length
instead of being
of a conversation.
Intimidated.
Exactly.
You find her nagging all the time. Why have you taken my baby to the nursery? How come she's like this?
Yes, it is very good because it helps you to know that this mother is knowledgeable and she knows what she's doing. And I think sometimes, of course, there are some who come and they're like, I'm hell-bent on this because I've read this. You know, there are some. But there are some who come in and she's literally telling you, I've found this. What do you think? Is it true? Is it not? What can I do? And when it comes to mothers and their babies, a baby is like the most precious thing when it comes to someone's child. And when it comes to pediatric health and all these things, babies are so beautiful. Pediatrics is a very beautiful field because babies don't pretend. If they're in pain, you will see them in pain.
There's reality.
There's reality. If they're dying, they are dying. Like, for them, you literally look at them. I always tend to compare.
You can't even talk to them and explain.
Now, what's something I always compare pediatrics to veterinary medicine because even animals don't speak. The way you're seeing it is how it is.
But much as it could be in pain.
So if it's in pain, you see its signs. If it's like gasping, you're seeing it. But you would be surprised with babies. When they get better today, by the morning, the baby who was gasping, you come and find them playing. And you're just like, this is so beautiful. And it is so rewarding, and you look and you're like, wow, like God is really good. And also now, this is I think the part where the two marry, maternal and mental health, because we've seen many things like postpartum depression, and mothers get depressed and their husbands cannot understand.
I was thinking about the men.
Yeah,
the husband. Talk about the post.
It's true, because I actually think I was watching Bump Love, the episode where the men had been brought, the Salvadors, and I think and Salvador especially, Idringi was talking especially about how the wife had suffered from postpartum depression. And this is something she didn't understand, and the husband didn't understand.
And they didn't even know they were going through it.
They didn't even know.
Someone external who told them about it.
So this is now how these two areas marry.
And the percentage, how can you rate it in a country, Uganda? How do we stand? Is it something that is alarming?
I think it's not. I think the problem is that the documentation is not really there because people don't really know. Like how you're seeing that someone doesn't even know that they're depressed. Someone doesn't even know that they're undergoing. Because, you know, we've seen, I personally, one time experienced, I saw a mother one time who got pregnant. Actually, so one got pregnant, and throughout her entire pregnancy, she was depressed. She wouldn't speak to her husband, to no one. She was having suicidal ideations throughout her pregnancy. And when she delivered,
she got
in 2 weeks she got better. And another one, when she finished delivering, I think this one, I think I saw the lady when we were in Ginger at the psychiatric area. And when this lady delivered, one time they found her burying her baby. And a live baby, she was literally...
I was thinking, was the baby alive?
Yeah, it was alive and she was burying it.
She was unaware of what she was...
Because up there, it was... And that is postpartum depression. And when it gets very bad, some patients get psychotic and very unwell. So I think she can talk a bit more about
You're
mental
passionate
health.
about it. What are your findings like in that world?
Yeah.
Okay, and before I move on to the mental health, maybe I would like to add on what Dr. Nyamroji has said about mental health, that when we are, it's one of the components that we use to evaluate the level of development of a country. These things that we say, underdeveloped countries, it's one of the components that we use, maternal and child health. So it probably explains why we have the ministry
why
coming
it has
in
to
at
be married
every,
together.
yes,
They work,
yes.
they go along together.
Yes. So now moving on to mental health. First of all, it's such a challenging field that, you know, when you're sick and you have a headache, you know I have a headache. But the challenge that we have with mental health, actually one of the diagnostic criteria, one of the things that we use to diagnose mental health is lack of insight. Like, these people don't know what's going on in their mind. Yeah, it's you outside who can see that they have a problem. For them, they feel perfectly fine. They can hear the voices, but that is now their new normal world. You cannot convince them that they have a mental health problem. Now, because we, the surrounding, the society, are the people to understand that they have a problem. Now the challenge comes in when we as society also do not understand the symptoms of the mental health challenges, or when we as society discriminate these people, when we stigmatize them. So now, even as the people who are supposed to be helping them are becoming a problem. However, I am very glad that very many bodies are coming up. The mental health field is becoming enriched as per now. Very many programs are coming up. Hello to Heaven Project, Hello to All for Mental Health. You guys are doing a great job in awareness, yes, and pulling up these people, these adolescents, and everyone who is facing these mental health challenges, addictions, stress, and everything. With increased technology and increased development and urbanization, incidentally, we found out that the rate of mental health challenges has increased. Yeah,
you have the at Mulago on a daily. You receive such cases.
Mulago usually has like the outpatient department mostly. So when we have an overwhelming number of like the inpatients, we use Butabika. However, we have those patients that you have on the ward for a very long period, maybe the chronic illnesses, so the stress, yeah, sometimes turns out to give them mental health challenges. So we have the specialists, we send in consults, they come and review the patients and start them on the medication. Yes.
I think, by the way, actually, before we leave that part of mental health, is that now at Chisizi for us, there is our psychiatric unit. It's called, we call it Ahumuza, and it has an overwhelming number of patients. And of course, the thing I think she spoke about insight. And insight,
both the women and the men, you receive such cases?
Yes, definitely. They are always there, and there are so many. And the thing that you're talking about, insight, we normally also use it in prognosis. And prognosis, we call it like the forward, how can you tell the patient will get better or will not? Because when a patient has insight, it means it's like when I know, let me say I have a diagnosis of, say, schizophrenia, and I know that I am schizophrenic, and sometimes, actually saw one time a documentary, but of course it was in I think it was a UK, from the United Kingdom, and this patient was a known schizophrenic for over 20 years, and this is a condition which is chronic, and sometimes the patients will see images, they will hallucinate. But this patient, the most interesting thing about them was that the patient knew their diagnosis, and they would be on medication. He was a teenager, and at one point, when I knew that this patient would definitely get better, 1000%, was at one point I was like, when he would feel unwell, like when his medication would get over, like get done and he hasn't taken his prescription for the day, sometimes he would be like in school and start seeing images, and he starts seeing like the walls are crashing in, people are turning into snakes, and what he would do, he would run and call his psychiatrist and say, I'm having an episode and I'm not well. That kind of patient is someone who is 1,000 times much better at going to get better.
They're able to make a phone call.
Exactly, because they're able to know that now things are not normal, than someone who will see them and now in their head they know this is my reality, I'm going to die, people are coming to kill me. And the truth is these things are really real in their minds. I was actually speaking about how she was saying that, shout out to the people that
taking
pushing.
initiative.
I saw some, I've been seeing some poster at around Spear Motors Nakawa, and I think it's a big billboard that is talking about, and it's it's in Luganda, like if you feel unwell, do you feel extreme fear, or do you see images that you do not understand, please call this number.
Instead of thinking maybe it could be witchcraft or I'm going to die at the end of the day. Of
course, definitely.
Wow. Yeah. For the viewers watching, good to have your company. And if you've just joined us, you're watching the national broadcaster. We're celebrating women in various sectors and getting to realize how ICT has really impacted the health sector itself. And of course, giving us more insight in regards to that, I have Dr. Prima, that is Nwampire Prima, and I'm also having just next to me Dr. Tumusime. Morunji? Nyamurunji. Interesting discussion right here. What needs to be done? I'll start with Dr. Prima because you've talked about salute to the organizations that have taken initiative and they're putting a hand to reach out to what the other medical people are doing, the national referral hospitals themselves, putting a hand to it. What else needs to be done? I know it's not like a government at Uyambi all the time, you're calling out the government. Yes, I'm sure you've also done lots of work wherever you are.
Okay, like I'd already mentioned, we have a lot to do at society level.
How do you do it at, is it Crochettville?
Crochettville is a different project.
It's a different project,
really.
nothing to do with mental health.
It has nothing to do with mental health. But at I will still come back to the community. I told, as earlier, I'd mentioned that these people, the people with mental health challenges, some of them, most of them lack insight. They lack the knowledge to know that I have a problem, I need medical help. They always think, oh, voices are calling me, I have to run to them. So it ends up with us, the people around them, the society, to diagnose, to understand that they need help. So I still come back to us and tell us to look out for these people. The other thing that stresses them a lot is stigmatization. I have seen a very stable schizophrenic, very stable, very quiet, until someone said, that one is mad. They don't like hearing that. So they feel stigmatized, and that is like, it destabilizes their mind.
She's just she's supposed to be put in Butabika, that's all.
So we can't continue discriminating them, we're just making situations worse. When I was in medical school, I had a lecturer, a teacher, who used to tell us that whoever has a mind, if you have a brain, you are at a risk factor of getting a mental health disorder. And mental health is not just schizophrenia, it's not just depression, addiction, stress, all those things, acute stress disorders here and there.
Too much pressure, too much tension at workplaces.
We get into all these things and maybe sometimes come out undiagnosed, so we can't say we've never suffered it.
Or we have the self-medication going through.
Yes, we also have that going on. So I just urge everyone in society to make life easy for their neighbor at the workplaces. People are getting acute stress disorders from work. Like we're having a lot of corporate people coming in with actually a higher percentage of them than people in low socioeconomic settings. So we are noticing that these things are coming in from workplaces, from maybe like businesses. We have things coming in from relationships. Yes, so we cannot, I still come back to the society.
So how can we avoid it? Living a day at a time, because at the end of the day the tension has to be there. You have to work, like you say, the corporate world coming to you. What would your advice be?
True. The advice, just be kind. Be kind to everyone. Like sometimes it's not like really, someone is like at the edge of falling off and you just push them and they lose it.
So sometimes it's not like necessarily one has to take medication. It's just as simple as that, an act of kindness.
Yes, an act of kindness. We usually don't diagnose these disorders until the symptoms have stayed there for like 2 weeks. So you notice that it's something that has been going on here, here and there, and someone just loses it at the end. So you we just don't want to pile on the stress that is going on people's minds. Yes.
I think in addition to what she's actually saying, I think when the act of kindness would especially suffice when someone, like, first of all, preventively. If, like, let me say, for example, you're in a home setting, you have your mother or your father, your primary caregiver. This person is going through so much stress. Even if it is your husband or your wife, and this person is going through so much. Because I have seen like couples and people coming that maybe the husband has lost his mind or the wife has lost their mind. Sometimes life can be very difficult, and life is not fair generally. Even the word itself, even the word of God itself tells you life is not fair. But sometimes if you have, let me say, for example, you're with your parents in your home and you see your parent is going through so much stress, it doesn't hurt sometimes just come and say, you know what, Mommy or Daddy, I see what you're doing for us and I really love you and I appreciate you. Make a glass of juice. Give them a glass of water. Honestly, it's the little things. Imagine if
it will take them far.
Imagine if you've come from work, you've come from a very bad day. Let me give maybe like people who are married, and I normally hear this from people who are married. You've come from a very difficult day. You've had, let me say, extension of work. Now, like for us who are into the medical field, you've had like, let me say, a day where you've had like 7 surgeries. You've had like a surgical day. You've had mothers coming in. You've had like 5 emergencies. You're going through the most. You reach home like a tree. And first of all, like your partner is there calling you. Where are you? What's happening? What? What's happening? And then you're not reaching. The baby is crying. You get home. The person now begins telling you, you see, you're in the business of cheating. What's wrong with you? Like, these are the things which just tip someone over. The time when she talked about most times people in the corporate world, we had one time a patient in GCZ, and this gentleman, he was a normal man, generally very normal, but he was I think working in one of in the fields of banking and whatnot, and he came in with like, I think what you're talking about, like acute stress that leads to like psychotic symptoms. So the man like would get so stressed, he would work like 24 hours in a day. When he goes home, he continues. When he does this, he continues. By the time he came, he was speaking to himself, murmuring to himself. And just a few days of work helped him to do what? To reset. Sometimes patients don't necessarily need drugs. Sometimes they need support. When it comes to things like addiction, people do not understand what addiction is. And people sometimes tend to sit...
It's about taking too much alcohol,
yeah,
you're addicted to
exactly.
such things. Yet you can be addicted to anything.
And even if it comes to the taking of the drugs themselves that you're consuming, people do not understand that addiction is a state of mind. You know how people are addicted. You know the simple thing is like our phones.
Every time.
You ask someone, if someone takes away your phone or your charger is off, people are like literally losing their mind.
They can't live a day with such a friend close to them.
And then because you see someone abuses alcohol, the thing with like alcohol and other drugs, they're going to cause physical manifestations into your body. Alcohol will cause you diseases that actually cause you pain and you feel it. Actually, speaking of, we're actually planning on a show that we're planning on talking about these things at length, that we want to start a show that we circulate to educate people more and discuss things about like alcohol, what are the impacts it has, and to get to know what are the things that people want to know addressed. Because sometimes patients can come to you with like myths and you're like, where did you get this information from? And you're like, by the time you came to hospital, I wish you hadn't done this damage to yourself. I wish you knew this information. By the time you came to me, treatment for you would be easier, would be cheaper, would be better. But now, like things like alcohol, this person is not drinking because they feel like they must drink. No, this person is drinking because now their mind has been adapted to feel this is its source of energy. The way you breathe and drink oxygen and have oxygen,
the comfort,
that's how it is.
In society,
exactly.
Because they have some money to spend.
Yeah.
Just
whether it comes to, there are so many addictions people don't know. These phones, they're addictive. When it comes to like things like alcohol, there's drugs, those are the common ones. Pornography, sex. When it comes to just things that are
day to day,
you'll find someone who is like a pornography addict pointing fingers at an alcoholic and is like, you're the one who's an addict. what do you mean?
Realizing what you're going through yourself.
Because at the end of the day, it is basically
for them, I think it's actually normal at the end of the day because they're comfortable.
Exactly. Now that's not having insight. Because you see, if I'm like me, as me, I feel like there is something that is controlling me. If it's controlling me, I'm addicted to it. How can I break loose? That is already knowing something is wrong, whether it's alcohol, whether it's drugs, whether it is pornography, whether it is sex, whether it is your phone, whether it is just attention of people. Like, you know how someone feels like if they're not around people, they cannot like function, they cannot, you get what I mean? So, yeah.
They tend to have the fear going through. They rather be comfortable when people are around them.
Yeah.
Okay. Oh, there's also like issues that people usually talk about when it comes to the pregnant women. At the end of the day, there is no heartbeat. What happens?
In terms of what? The baby?
The baby. There is no heartbeat at the end of the day, yet you felt there was something. We've had such cases among the women.
Yes.
Is it because the different, you're not on a better diet? Is it because of the tension that goes through nowadays? And then they have complaints going through. Our mothers never used to be like this. The women back then, you know, could it be where there's a lot of radiography? I mean, do the scans and all that. What really happens?
So there are so many causes as to why a woman could, you know, lose their child intrautero, in the uterus. Stress can be one of them, like we had already mentioned. Physical insult, if, for example, a mother is like on a board and they fall off, or we've had cases of domestic violence where they fight with the man at home and it's very painful. The mother comes to the hospital and we can't pick the heartbeat, and of course when that happens, the child is dead in the uterus. Yes, we have, but then also, I think that way back, because we've talked about the improved ICT and diagnostic procedures and all that. So I think back then, maybe some of these things used to happen and just go without being noticed. Yes. Without the statistics being taken and all that. But now, because of the improved ICT, we are able to pick up all those cases. Back then, we had traditional birth attendants. I have not interacted with so many. My colleague who has been up country can tell me if she has. But
the ones that she sings here.
I don't know if they listen to the heartbeat or what. But I think it was God's grace. But maybe they would deliver and the child is dead and they'd be like, oh, probably it happened.
Or maybe witchcraft.
Of course. Someone said when Africans have no explanation to anything, we shall say it's witchcraft, just like that. So maybe with the advanced ICT, we are able to pick more of these cases because we're able to diagnose them early and pick them. Yeah, but there are so many causes, very many. We have preeclampsia. We get mothers who get high blood pressures during pregnancy, and the high blood pressures have a direct impact on the child as well, so they can cause death in utero. We have mothers who get diabetes, high blood sugars during pregnancy.
Yes,
the mother has been, the mother has been normal.
But then later on they say there's that issue. When they give birth, it later goes away, right? When they give birth, later goes away with time, of course. And medication.
Yes, on medication. Give medication and it goes away. So it's pregnancy related. All that, the changes that come in with pregnancy and the hormones acting up here and there cause all these physiological, pathological changes that directly affect the baby.
And then you give birth to a baby who has, what do they call them? Like, say if the skin is not it's not the same color, then you're like, what did you eat? Something could have burnt the baby while in...
I've had that in twin pregnancies. Okay, the myth that you're talking about, where they say, oh, in Luganda they say, oh, abalongo bamwocha. Those things, but they're actually pathologies that happen during pregnancy due to the hormones and every other interplay that is going on.
A little into details, one would think pathology, and then you're like, these ones are talking about rocket science.
Oh, pathology is disease, because initially I think I'd said physiology is like the normal thing that is happening. For example, your digestive system being able to break up food is physiological. If anything goes wrong there, we call it pathological. Yeah.
Certain things you can't reverse them.
Yeah.
One has to get on medication.
Yeah.
Yes.
Okay.
And
Dr.
that is-
Tumsime, I'd love to add something.
And that is I think that is the most important thing about making sure that you're getting your health care from qualified professionals and in a hospital setting. Now, for us, most times we'd have the challenges where you find, and it's not just in the low resource settings. It is that even in the upper, you know how people nowadays talk about like herbal medications and what, and those things. You see people, you know, I personally have no problem with herbal medication because I feel like, first of all, most of the drugs that we know and have are extracts from herbal medication. The problem with herbs is the fact that these things, there's no prescription. There is no actual dosage. We don't know the active component. How is it working?
Taking like a whole glass of sugar.
Exactly.
But also to interject
With the
sorry,
herbal
before you-
medication.
with the herbal medicine, before you continue, is that the pharmacists, okay, those who manufacture the drugs, find out the useful extract. That's why it's called an extract. They extract it out and they leave the other useless things, pour them away. But now what we do as herbalists, as what they do as the herbal medication people, they just crush everything together and drink. So you're taking,
Not having the right content, like the right measurements.
you're taking the right prescription, the right extract, but also you're taking the non-important things, actually the harmful substances
You're
in
consuming
there,
them at the same time.
everything.
And more of them in plenty, not having like
Exactly.
say a 2 spoonful. You know,
And because our liver is the one that is responsible for detoxification, at the end of the day, these people come to you with drug-induced liver diseases and all that.
I think there was actually one time we had a mother who came to the hospital, and she came with that. They had taken these herbs that are for inducing labor from their village place. And I think the drug is actually the right drug. The right drug was given, but the prescription was very wrong. Because even us, when we're giving a prescription, there are some drugs that you do not play with because you're literally dealing with 2 lives. By the time she came into the hospital, her uterus had ruptured, her baby had died, all these things, because the dosage that was taken in that drug was extreme. It's like almost like 40 times. So the pain becomes abnormal, the uterus cannot take it, and it just ruptures. But especially like what she was saying, there are things that must be tested continually, things like your blood pressure, your glucose, your blood sugar status. You're asking if they heal. Sometimes they heal, sometimes they don't. You need to assess your kidney function. How is it? Because you as the mother, you're like the monitor, you're like the machine, life machine for this baby. If something goes wrong with you, it's going to go with it. Some babies are born with malformations and they are not okay generally in there. So today you are moving, you are playing, tomorrow you're not. Another thing is the mother is always the best monitor. The mother is always the best
People
monitor.
have the fear that is, oh, it's so expensive when I start going to check on my organs.
No,
oh my
no,
God.
no, no, no.
You're
need
going to ask for millions.
No.
Is it the fear of the money, or it's the fear of finding out?
Getting, even that is also part of it. So what is going to happen if I find out my kidney is wrong?
Sometimes
Then you
it's the
get
fear
help.
of finding out.
Yes.
Then you get help, because the thing is, what will how if you're saying the fear of how only becomes reality and now you're dying or your baby's dying, what happens
I've heard people
then?
say, I'd rather die without knowing. They said that the worry of them knowing
The status
will kill
of
them
certain
faster
things.
than the disease.
Yeah, I think that's like something that is very true, and you need to be in continuous service. And there's some things that are always very simple that you see immediately. Like if you're a mother and you're pregnant and you feel you've not felt the baby kick today, get to your hospital, because you always feel the baby playing. Why is it not playing? Because the baby's heart gets tired, and the baby gets tired slowly. When the supply to the baby reduces, it will first stop moving too much. So it will first keep quiet, and like you know how when you're tired you try to reserve your energy. Now that's like your first stages. Now from there the reserves are continually shutting off. So what happens now? Your body is giving way. By the time the mother comes, because we would see mothers who would come, by the time she comes, she says, I last had my baby's heartbeat like 70 72 hours ago.
I know.
So
Or maybe like even a week ago.
A week ago. So now what were you doing at home? By the time the baby comes, the baby has become
They're trying to get the
septic.
money. Others will be like, I'm trying to, you know, get that money to come.
Some be saying they're trying to get money, but some just don't even pay attention to it. By the time
So
she
what happens,
comes, she's
before we
sick.
let you go, our time is fast spent.
Yeah.
Before we let you go, you do surgeries.
Yeah.
What are some of those cases that you deal with on a daily or maybe in a week?
Thank you, Constance.
We'll start with you, Dr. Prima.
Okay. Generally, we do cesarean sections for mothers who have failed to, do vaginal delivery, deliver what people call normal delivery. Yeah, so there are cesarean sections done, and I happen to rotate in Kawempe National Referral Hospital. That is nowadays people call it Mulago Yabachala. The obstetrics and gynecology unit of Mulago is in Kawempe, and on an average day would have about 17 cesarean sections. That is in 12 hours. So in 24 hours, that would be an average of around 34. Yes, 34 cesarean sections going on. And they would all be emergencies. Some of them are the people who have been attending the antenatal from Kawempe. Others are the referrals that come in from the peripheral clinics, hospitals, but then also it being a national referral, we have those coming in from up country. Yes. So
it's always a busy day.
It's a very, it's one place you go to, you stand in theater
and people complain and like I was not attended to.
Yes, you have like a continuous line. So that the team comes in, yes, it does all those 17 surgeries like I've said, and we have two tables running. We have this side is running, this side is running, so people are working. But then you reach your handover time and you still have like a whole long line, so other people will start from there, but then also them, they will not finish, they will have another line.
Another
so
shift will come
yes,
through.
you're not going to have a time of, now we are breathing, now we don't have any mothers on the list, we don't have any pending surgeries. No.
So apart from the cesarean, which other common surgeries do you deal with?
Apart from the cesarean sections, now we come back to the main Mulago, because that is where the main surgical center is, the Department of Surgery, where it is, and it's subdivided into different departments. Depending, I was talking to someone, I'm like, Mulago, every body part has its own unit, because it's a super specialized hospital. So we have the intestines, the GIT, the gastrointestinal system, talking about it, divided into the upper part and the lower part. Still, the units are separate, and the cases that we get in those units, we have cancers of the esophagus, we have cancers of the stomach, so they reach a level and they reach somewhere. Still, because of late diagnosis, people come in late and you find that you sometimes have to do resection, and before
With your
you
findings,
start them
what could be the problem? Is it because of the poor eating? The findings when it comes to such cancers, is it because of poor feeding?
Oh, there are so many risk factors to that. Yes, we usually associate especially cancers of the stomach to eating junk food, those roasts, consuming too much salt. So as you do that, you think about your stomach. Yeah, but then there are other factors. There are genetic factors, there are environmental factors. It's an interplay of so many things going on. So yes, we have at different levels, there is a surgery going on, and then we go down. We have cases where you get the intestine twisted and it needs a surgery.
Encourages, we call it sacrilege, and to allow the pregnancy to grow longer. And in the surgical department, we have a lot of suturing and these things because of the alcoholism I've been mentioning, the assaults and what. So someone comes to you when their skull is open, when they're bleeding in the brain, when they have like large open wounds. The same thing, talking about the intestinal issues. So we'll be suturing and closing, laparotomy. So yeah, basically.
Dr. Prima, we can't stress all this. And it's really a lot of information. How I hope that you make more time. Time is against us. Dr. Prima, a word of encouragement before we briefly go to Dr. Tumusime.
Okay.
One word to our wise is enough.
So much. Since we are talking women in health, I want to give an encouragement to a woman out there or a girl child out there pursuing medicine or health sciences or anything in relation that yes, we find so many hurdles and challenges down here, but we get up and you find that there is a patient who come in and they say, I want a female doctor. So there is hope, there is just focus and get up here. The future is bright. Thank you.
Wow, amazing. Finally from you, a word of encouragement.
The fear of the Lord is the beginning of wisdom. Every time when you have the fear of the Lord within you, you will not do things that you're not supposed to. You have no business doing, whether in your private or you're in your public place. But also anyway, since we are leaving, we'll also be, like I said again, we're going to be having a show with Dr. Prima and we'll be hosting other doctors to have more of such conversations, to educate people, so that people avoid some mistakes that cost life. Yeah, I think let's just keep that. I think maybe we shall have it on multiple social media platforms. Maybe they could also follow. I think we use the same names. She uses Dr. Niwampire Prima. And I used Nyamurungi Tumusime and Nyamurungi BT on most of my handles, Twitter, so, Instagram, and the like, WhatsApp. So we shall be putting content out there to help us, like, to educate people, really. Yeah, so thank you.
It's been a pleasure spending time with you. We do apologize. We did start this episode a little late because of the live that came through. It's Easter as well. With the Archbishop, a message from the Archbishop. And well, these women really traveled to be here and inspire you and educate you and say so much that you can really benefit and tap from the extreme. And I had a Dr. Niwampire Prima, bachelor's degree in medicine and surgery, medical doctor at Mulago National Referral Hospital. She's also a publicist and a publications officer at Patient-Centered Care Movement, entrepreneur, co-founder at the Quarterville, Uganda. She's passionate about mental and the health, the mental and maternal health and preventive medicine. It's been a pleasure spending time with you. I also had a Dr. Nyamurungi Tumusime, medical doctor, trained with a bachelor in medicine and a bachelor in surgery. She has done a lot of work in Fort Portal, Hoima and Jinja. She's enthusiastic about maternal and child health care, and she has done a lot to do with community engagements. Wow. Well, I believe you picked at least one or two things. My name is Sandra Kahunde. Well, our conversation ends now, but hey, more to come your way when it comes to celebrating women right here in nation Uganda. Enjoy your day, enjoy your holiday, and please practice the message that the ladies have happened to share with you as you enjoy this holiday to the Christian brothers out there, as the Muslims also continue fasting. My name is Sandra once again, and thank you for choosing the National Broadcaster. Better programmings are coming your way, so keep watching. God bless you.
UBC, inspire.